Okay, I was asked a question about failure to diagnose chronic health conditions. These, just by way of information, would be things like diabetes, uh, hyperlipidemia, which essentially translates into high cholesterol, for lack of a better term. You could add chronic obstructive lung disease, which is essentially emphysema that we see a lot in long-term smokers. These are illnesses that aren't like a catastrophic auto accident or a very aggressive cancer or trauma sustained through fall or other peril. These are chronic health issues that arise generally either as a consequence of just bad luck or genetics, and sometimes related to lifestyle. Diabetes is frequently family linked, although it can be related to significant obesity. Chronic obstructive lung disease is usually smoking related. And high cholesterol is to some degree genetic, but also related to how much fat you take in your diet. Again, these are issues where you have some horizon that's a long horizon. They cause problems generally only when they've been ignored over long terms. It's a two-sided issue because the doctor has to make the initial diagnosis, and the patient thereafter has to also participate aggressively in their own treatment. You have to treat diabetes daily, the same typically with high cholesterol, and the same frequently with chronic obstructive lung disease. So the key is for doctors, keep an eye on those labs, keep an eye on pulmonary function in the case of long-term smokers. Keep an eye on the diet if you're a patient. Be sure your blood sugars are checked regularly if you're diabetic. The doctor's chief responsibility is going to be making the timely diagnosis. So if you go to see a physician and you have sugar in your urine, or perhaps your blood sugar is high, or you have an elevated hemoglobin A1C in the case of diabetes, and you're not made aware of this disease for a prolonged period, and you suffer damages related thereto, you may have a case. Probably more importantly is, as a patient, be sure to always continue your treatment. It demands a lot of dedication. You got to stay with the program, and be sure you see your doctor.